What if modern medicine wasn't simply the natural triumph of science over superstition? What if the system we rely on for our health, the hospitals, the drugs, the standardized training, was deliberately engineered over a century ago by a powerful alliance of industry, philanthropy, and reformist zeal? Before 1910, American medicine was chaotic, competitive, and remarkably diverse. Dozens of medical schools taught everything from herbal remedies and homeopathy to osteopathy and eclectic practices. Patients had real choices. Then, almost overnight, that diversity collapsed. A single report, backed by immense wealth, redefined what real medicine meant, and the consequences still shape every doctor's visit, every prescription, and every health policy today. This is the hidden story of how modern medicine was architected, not just discovered. The chaotic marketplace of healing. Before 1910, at the turn of the 20th century, medicine in the United States was anything but unified. It was a vibrant, unregulated battlefield of ideas. Conventional allopathic doctors, who relied on bloodletting, mercury, and harsh purgatives, competed fiercely with homeopaths who used highly diluted remedies based on like cures like. Herbalists and eclectic physicians drew from plant-based traditions. Osteopaths, founded by Andrew Taylor Still, emphasized the body's musculoskeletal system and its ability to heal itself. Naturopaths promoted natural cures, diet, and lifestyle. Hundreds of medical schools operated with wildly different standards. Many were small, proprietary institutions with minimal entrance requirements. Some had no laboratories. Others lacked teaching hospitals. Quality varied dramatically, and patients often chose treatments based on philosophy, cost, or personal experience, rather than rigorous evidence. This pluralism reflected America's entrepreneurial spirit, but it also created problems. Inconsistent training, questionable practices, and public confusion. Critics called for reform. The question was, who would lead it, and in which direction? Industrialization, oil, and the rise of synthetic medicine. The answer emerged at the intersection of two revolutions, scientific and industrial. John D. Rockefeller had built an empire on oil. By the early 1900s, that oil wasn't just powering machines, it was feeding a booming petrochemical industry. Companies learned to isolate and synthesize chemical compounds on a massive scale. These new synthetic drugs promised consistency, patent protection, and profitability that traditional plant-based remedies could rarely match. At the same time, laboratory science was advancing rapidly. The germ theory of disease gained traction. Researchers isolated active ingredients and created standardized medications. For industrialists and investors, this wasn't merely progress. It was an opportunity to turn medicine into a scalable, patentable industry. Rockefeller's advisor, Frederick T. Gates, saw the potential clearly. He envisioned a medicine grounded in laboratory science that could be industrialized. But first, the chaotic education system had to be brought under control. The Flexner Report, the blueprint that changed everything. In 1910, educator Abraham Flexner, who had no formal medical training, published one of the most influential documents in medical history. Commissioned by the Carnegie Foundation for the Advancement of Teaching, the Flexner Report evaluated 155 medical schools in the United States and Canada. Flexner visited them personally and delivered a scathing assessment. His conclusions were uncompromising. The country needed fewer and better doctors. He praised schools modeled on Johns Hopkins, with rigorous science, full-time faculty, laboratories, and university affiliation. He condemned most proprietary schools as inadequate, lacking proper facilities or scientific grounding. Flexner's famous line captured the philosophy: "The practitioner who is not a man of science is a charlatan." He drew a hard line. Medicine must be rooted in biology, chemistry, physiology, and measurable laboratory results. Anything outside that framework was sidelined as unscientific or sectarian. The impact was swift and brutal. Within a few years, more than half of all medical schools closed or merged. Homeopathic schools dropped from 22 in 1900 to just 2 by 1923. Many schools serving women and black students also disappeared. The number of medical schools plummeted from over 150 to around 70 by the 1920s. The power of philanthropy, funding the new model. Ideas alone don't reshape entire professions. Money does. Flexner's vision required expensive infrastructure, modern laboratories, teaching hospitals, full-time researchers, and rigorous admission standards. Small independent schools couldn't compete. That's where Rockefeller and Carnegie stepped in. The Rockefeller Foundation and General Education Board poured tens of millions of dollars hundreds of millions in today's money, into schools that adopted the new scientific model. Schools that aligned with laboratory-based allopathic medicine received massive endowments. Those that taught homeopathy, herbalism, or other approaches were largely cut off. Abraham Flexner himself later joined the Rockefeller-funded General Education Board, helping direct funds for over 2 decades. His brother Simon Flexner headed the Rockefeller Institute for Medical Research, further cementing the alliance between philanthropy, science, and the new medical order. The result was a complete restructuring. Medical education became centralized, standardized, and tied to research universities. Licensing boards adopted stricter scientific criteria. The American Medical Association gained influence in accreditation. Alternative practices were pushed to the margins or forced to conform. The lasting legacy, triumphs, and trade-offs. The transformation delivered undeniable benefits. Medical education became more rigorous. Standards rose dramatically. Breakthroughs followed. Antibiotics, vaccines, advanced surgery, and evidence-based treatments that have saved countless lives. Today's doctors train in sophisticated systems grounded in science. Hospitals operate with protocols tested through research. The pharmaceutical industry has produced miracle drugs that treat conditions once considered untreatable. But the shift also narrowed the definition of legitimate medicine. Practices emphasizing the body's self-healing capacity, holistic approaches, prevention through lifestyle, or traditional remedies were largely excluded from mainstream training and funding. Osteopathy survived by adapting and incorporating more biomedical science, eventually gaining full recognition. Many other traditions faded or went underground. Critics argue this created a system heavily oriented toward pharmaceutical and surgical interventions, a model that excels at acute care but sometimes struggles with chronic disease, prevention, and individualized care. The influence of industry funding on research and education continues to spark debate about conflicts of interest. Was this evolution inevitable? History rarely offers simple villains or heroes. The pre-1910 era had real problems with quality and quackery. The Flexner reforms professionalized medicine and elevated standards at a time when science was advancing rapidly. Without standardization, modern breakthroughs might have been delayed. Yet the concentration of power, industry interests aligning with philanthropy and elite institutions, undeniably shaped which paths were funded and which were closed. Medicine became more scientific, but also more centralized, and tied to a patent-driven pharmaceutical model. The blueprint drawn in 1910 still guides much of how we train doctors, approve treatments, and deliver care. We live inside that system every time we visit a physician, fill a prescription, or debate healthcare policy. The question that remains. So here's the deeper question we must ask today. What do you think? Was the Flexner era transformation a necessary upgrade that saved medicine? Or did it close off valuable paths we're only now beginning to rediscover? Drop your thoughts in the comments. I'm reading every single one.